Hi, this is Dr. Kim again. Today I'd like to talk to you about my secret sauce, herbal injections. Well, this herbal injection, as you can see, you see all the botanicals here. They're made of 12 different herbs and 2 minerals of calcium. Now, all the botanicals are very familiar ones that you've probably heard in the past, such as arnica, which is a very strong anti-inflammatory, Belladonna, Chamomile, Echinacea, St. John's wort. These are the few that you already heard. All the other ones are very familiar with it as well. These are very powerful herbs that are anti-inflammatory, also has a lot of nourishing vitamin and minerals and antioxidants and all kinds of nutrition in them, so that when I inject into the area of the pain, it not only decreases inflammation, but it nourishes the area to regenerate cells, which is a very important distinction between cortisone and this herbal injection. So cortisone, as you may know, is very powerful. It's a chemically made, strong anti-inflammatory. It works very well. I still use them at times for different purpose, so whether it's a joint pain or other area like tendonitis and other pain. However, if I put it into this area of the Achilles tendon, and then that weakens, it decreases inflammation. However, it weakens, and it weakens to a point where it can completely rupture, which I've seen in the past. So we are definitely tabooed not to use the cortisone injection around this particular tendon to prevent any kind of complication such as a rupture. So what I do for this particular injection is I get you on your stomach like this, and I would numb up the area with anesthesia, because I don't want to keep poking around with this herb without you being comfortable. So a lot of people are very afraid that, is this going to really hurt me? Well, it's going to hurt a little bit when I'm numbing the area. So I spray with a cold and then put the needle in, and then I numb up the whole area, wherever that may be. It could be up in the tendon area where I'm trying to reduce the bulk of the tendon, or down in this area whether there's a bursa or there's a tendinosis. Remember tendinosis, where there's a hardening of the scar tissue that needs to be broken down. So I check which area is the most tender area, and then I inject a specific area to dissolve the scar tissue, get the mobility and flexibility back into this area. And then I tape it up really nicely so that whatever I put on the medication or the herbs can stay in there, work for at least 24 hours. So the tape will stay for 24 hours, and then I ask the patient to stay off this area. No walking the dog, no cooking, cleaning, laundry. A lot of the house stuff even, you should really curtail doing so, because that can really make the whole herbal go all over the place. We want the herb to stay there and work while you are kind of laying down and taking it easy, watching TV, or do something pleasant without being around too much. Then it can really improve the condition quite a bit. People ask me how quickly would that work? Well, with my experience, about every injection I do, they improve about 20 to 30%. So usually, unless you had this problem for many years, then it's going to take a little longer. But most people, they've had problem for 2-3 months, then it can get better within 6 to 8 weeks or so, because we do injection every 2 weeks. And then during that time, I get you to stretch, I get you to do therapy. I already got you nice custom orthotics or over-the-counter orthotic devices, so they can stabilize the foot to prevent it from getting worse. I hope this whole video series has helped you. And if you happen to be nearby, then you want to come by and get the injection or get the treatment. If you happen to be pretty far away, then you may have to find somebody who can do this herbal injection for you, so that you can improve this condition completely. Good luck with all your activities, all the favorite sports activities that you may want to go back to, all your home activities that you enjoy doing with your family. You may be able to continue after you completely get this problem resolved. Thank you so much for watching. We'll see you on the next video series. If you have any questions or any comments you'd like to make, please make them below so I can answer all of them accordingly. Thank you so much.